Hello, we will be talking about implications of phosphorus level in a person of chronic kidney disease. Now, many people believe that phosphorus starts rising early in the course of chronic kidney disease, and this rise in phosphorus leads to a battery of changes which involves calcium, involves vitamin D, involves parathormone, and so many other things. Now, this phosphorus is actually compensated and controlled by trade off, leading to some damages in the body. So, this high phosphorus level is ultimately bad for body. This may lead to pruritus when patients are actually having itchy skin. This may lead to calcification of the blood vessels, which is very injurious and which lead to cardiovascular morbidity. This leads to pimples in the skin. This also leads to weakness of the bones, and ultimately overall phosphorus is one thing which should be aimed at correction. Normally, the protein-rich diet which is encouraged for any kidney patient is also rich in phosphorus. So your nephrologist would be giving phosphate binders, which if you take along with food, then it is expected that phosphorus of the food will be bound with the phosphorus binder and it would be excreted with the fecal matter. But most of the times there are few other food items which are not useful for you, rather harmful for you when this comes to phosphorus, such as maize, millets, and most of the time the skin of grains, these are very rich in phosphorus. Coffee is very rich in phosphorus. Chocolates are very rich, and colas are very rich in phosphorus. So normally when this comes to CKD patients, we tell them to avoid such kind of food. We tell them to avoid cola based drinks. We tell them to avoid coffee. Even if phosphorus is cleaned by dialysis very well, but because of the bad dietary habit, this accumulates. In centers where dialysis is given for a longer period of time, such as European countries where they practice nocturnal dialysis, phosphorus levels are better controlled. But most of the places where dialysis are given inadequately, phosphorus level increases, and this is ultimately injurious for blood vessel, bones, and entire human body. So it is always better to optimize dialysis, and it is better to have some dietary restriction, and also it is better to take the phosphorus binder at the right time in right manner. Thank you.